we're going to go over ankle sprains from an anatomic standpoint, and I'll show you guys essentially what that injury means and a little bit of the treatment plan. So an ankle sprain, your typical ankle sprain, is going to occur at this ligament here. This ligament is called the anterior talofibular ligament. It sits on the front, that means anterior. It goes from the talus to this bone, the fibula, and it essentially restrains the foot in the back of the ankle joint. And so when this ligament is injured, it's either a partial sprain where you have some tearing of some fibers or some slight stretch. It can be a complete tear, and it can include this other ligament down here called the calcaneofibular ligament. Very rarely does it include the ligament on the back side called the posterior talofibular ligament, but this is it right back here. So essentially, when you have that injury, depending on how unstable it is, you can be immobilized in an ankle brace. Sometimes if it's grossly unstable with a test called an anterior drawer test, you have to be in a cam boot for a long period of time. But really the biggest thing to remember is you have to do physical therapy with these. You have to work on your balance, your proprioception, you have to fire the peroneal tendons that sit over here, and they actually resist that inward twist. So strengthening those significantly decreases the chance of chronic ankle instability. So the issue if you develop chronic ankle instability is your ankle is loose, you get abnormal wear and tear into the ankle joint, and it actually increases the chances of arthritis. So if you have a sprain, come in to see us. We'll make sure you're nice and stable, get you to physical therapy, and get you back on your feet.